Do one more. There's another layer. Good. So we have Lorena here today. She's a dancer here in New York City. What are some of your spots you want to look at today?
My right oblique and like the right side of my neck and shoulder.
Okay.
Yeah.
So it's all the right.
All the right.
Tell me about, let's start at the bottom. So tell me about, where's the pain coming from?
So
You're turned halfway this way.
So the pain's coming like right underneath the ribs.
Okay. So she's not actually pointing to the spine. Here, keep turning.
Yeah.
Keep turning and move your arm away for a second. So here's the spine in the middle. She's pointing 4 or 5 inches out to the right. She is right under the ribs here. And there's like a tender spot right here though, right? And
yeah.
So you feel a lot here. Do you feel it when you're not moving or you have to create a movement or pressure?
That one initially, I can feel it just standing still or lying down. The front is like, it's like.
So you feel both?
Yeah, it's when I'm moving. Like,
okay. So you start here, do that half moon twist and you feel it right in here?
Yeah.
Deeper on the surface.
I feel it deep.
Okay. And so on a scale of 1 to 10, what is this when you're not moving? And what is it when you do your stretch?
Not moving, I'll say 4 to 5 because I'm not really aware of it.
Okay.
Yeah. It's just there.
To me, a 4 or 5 typically is you are aware of it. Like I would call it like maybe a 1 or 2.
Yes,
like
1 or 2.
It's not even on my radar.
Yeah,
until
1 or 2,
I think
and
about
the back is a 4 or 5 standing.
Standing.
Yeah.
And then when you create a movement, then what number does this jump to?
This jumps to a 5 because I'm very
now you're totally feel it. And I'm not trying to change your numbers, but I just want to be on the same number as you.
Just
on the same page of numbers.
Yes.
Because I'm just trying to see what exacerbates it or what spikes it. And that movement
definitely
spikes it.
Yes.
Okay, so you have this. Then you also pointed something up at your shoulder blades.
Yeah. I don't know if it's
turn around
traveling to like right underneath the shoulder blade and then this whole area.
Okay.
Like I feel like my shoulder blade is not connected to my back as much.
Okay, so we have to look at that too. And then your neck. How much is your neck hurting? Is it a big part of your life right now where it's nagging you?
Yes.
Well, you're also a dancer, so it's going to get in the way.
Definitely, because I do dance and we do use a lot of our upper body, the tension here, I have to just alternate some moves because I don't have as much mobility in it, or it just cracks right away.
And here, turn this way a little bit. Hold your arm out in front of you, make it strong. And now turn your face that way. Hold your arm strong. Good. Turn your face all the way this way. Hold your arm strong. So that's the bad side. Tilt your head to the right. So it's a right lateral flexion. And then tilt it this way. Hold. And tilt it back. And tilt it down. Good. And go right rotation again as much as you can. And tilt it back a little bit. And there it goes. It goes weak. So I see where it's coming from. All right, we have some stuff to do. There's a few things. Let's see where we'll get started, okay? Actually, start on your back, please. And you're going to scoot to the end of the table here. Maybe I'll lift the table just a little bit so I can fit my legs under there. Okay. So the right side, how long have you noticed the hip and the front of the...
Last year.
Oh, it's been around that long?
Yeah. I've been thinking stretch it and do different exercises for musculature, purposes.
Did you see a medical doctor to make sure there's nothing internal on that?
Yes, I did.
And what did they check?
I was crazy for dancing and I should take ibuprofen. Maybe I can.
What was the crazy part of the dancing? Was it just...
Because I wasn't resting enough to let it heal.
Oh. What did she say, though? She said it wasn't organ related,
no,
right?
It definitely was not. She said it was muscular.
And she called it the oblique, right?
Yeah.
Yeah. Do you feel that spot right there?
Yes, I did.
Okay. Because that's the spot that was getting in the way of that right rotation. Do you feel like I'm on the bad spot?
Yep.
Good. So I'm just going to stretch this one a little bit. Good. So I'm going to adjust this if that's okay. All right. Take a breath in and relax, or let it go. It's easier for me to say relax than for you to relax, right? All right, so I'm gonna go deep into that spot, and I'm at the base of the neck here. Not as bad as you thought. I'm gonna do one more. There's another layer. Good. And take a breath and blow it out. Not as bad as you thought it was gonna be, right?
No, because pressing into it, I felt painful.
Yeah, because I got on the nasty spot and I was digging in to see if it felt like that was, I was trying to locate the worst of it. So I'm going to do the same thing on the other side, just to get that. Come stand up again. So I'm going to have you stand right here next to the table, and I'm going to come around and meet you up front now. Come up here now. Let's just retry that rotation thing, okay? Remember, you turned all the way to the side. Hold your arm up. Keep your arm strong. So it's already taking some of the pressure off the nerve there that was being irritated. And that's where you're getting a little bit more, power. Do you remember the arm faded? If not, you can watch this back and see how it faded. Yeah. Let's just do it one more time. So turn your face all the way this way. Hold your arm out strong. Make it strong. Yeah. And it's nice and strong. So we're starting to take some of that pressure off. The body still needs to heal. Yeah. So that's what the body does. But sometimes a successful chiropractic adjustment takes that nerve interference out of there. It allows the body to restore its balance again, because it wants to do that. The body always wants to get towards homeostasis or balance, but sometimes there's stuff in the way.
I already feel a release. Like I can actually do this and I have to find an alternate route.
So do you feel like letting me work in there a little bit?
Yeah.
Okay, so I'm gonna have you lie on your back. I'm gonna give you a pillow from your head. So lie on that. I'm gonna have you pull up your sweater just enough to expose your stomach. And bend your knees, because when the knees are bent, we get a softening. And I only want you to pull your band down enough that I can get to the spot that you hurt. Okay, that should be enough. That's plenty. Okay, so we're going to go below the rib cage. And you can help me. I'm going to lift the table up. Okay. You can help me zero in on this. A big part of what I do when I practice is I just ask the patient. Yeah. Like I could prod around, I could keep you silent, and then prod around and wait till you wince. And that's one way of finding it. And another way of finding it is just to ask you. Yeah. And then start from that point. But I think I'm close, but now I'm going to ask you, dig in and help me find it even more accurately. And yeah. So it's right there, right?
If I contract something, I definitely hear some things move.
Okay, so contract.
Sometimes,
So what do? Can you do like a stomach crunch, or does that really hurt this area?
No, it doesn't hurt it, but the next day it'll probably burn a little.
Here, get this arm up here so we don't bump into each other. I am gonna have you put this leg straight, okay? I just want to see the difference, and you can put this one straight too. So I'm gonna go under, and I'm gonna try to stretch this a little bit. Okay, so now I'm on it. There is like a band here. Ooh. Let me see if you have it on both sides. A lot of times I learn by going to the so-called normal side and just see maybe you feel the same way on both sides, but this side doesn't have that type of ropiness. You feel it? I'm on it. So what's interesting is I'm squeezing the front and the back at the same time. So the stuff you feel in the back is the same exact muscle.
Oh, okay. It feels like a braid of tendon.
To me, it feels like a cable that suspends a bridge. But here I am in New York City talking about bridges, but it feels like a steel cable. But now I'm on both sides of it. Yeah. Do you feel it? Yeah. It should really hurt.
It does. I have a high tolerance for pain, but it hurts.
Pick this knee up. I want to see if it's not the psoas, because the psoas would make that jump. See, I'm higher above than a psoas, but I just want to see if the psoas was involved. So I'm really in there. Here, we come around with the camera this way, and I'm in really deep in there. Going in really, really deep. And it keeps jumping on me. I know it kills, but I'm gonna get this to release a little bit, okay? So now stretch that leg straight again. I'm gonna take your top of your pelvis and pull away. Now I'm gonna also use this tapping instrument. I'm gonna put a high speed tap into it, which can okay. Come stand up again, okay? The table's much higher. You can set your sweatpants comfortably. Now, I went in there,
It
okay?
was definitely burning a lot.
Because I was on it, right?
Yeah.
Try to do the stretch.
Oh,
Oh, what?
yeah. It's released so much. I don't feel any of the pulling. Whoa.
How much is it released?
I'll say
10%, 20, 40?
no. It feels like around 50%, 60%. Because I would stop here and already feel the pain, and the fact that I'm like over.
So here's the thing.
Whoa.
I know how to help that.
Yeah.
It's going to probably take a couple of sessions, so it's up to you whether we just met. We've never worked together. But that's something I know I can help.
Amazing. Yeah.
And the reason I know I can help is because I found it.
Yeah.
If I can't find it, I can't get to it. But I was able to get my thumbs in there. Besides being a chiropractor for, I don't know how long, since 1998, so 21 years. Before that, I was a massage therapist for 8 years. But a big part of my massage work is I worked with people with a lot of serious health issues. I worked with a lot of cancer patients for years. And I also would do a lot of stuff in the front of the body. So I would have people come in, maybe they had abdominal surgery of some point, but a long time ago, but they still felt like they had adhesions and restrictions. So way after their surgery healed, they got the green light to do whatever they want. They survived, but they had like scar tissue and adhesions that would give them chronic pain. And I knew learned and knew how to go in there and like make it more taffy-like or more malleable. Because if it feels like beef jerky or stringy or very like tough meat, like when you eat a piece of steak, you want like a really tender piece of steak. You don't want to eat that fibrous, like gnarly part, right? But you feel like gnarly on the right, but normal on the left. That's why I went and figured out the left to see what that felt like. And the more I could stretch it and open it, make it more taffy-like, the more the pain will go away. Try stretching one more time. So you see there's potential.
Yeah.
And it's been like that for a year, right?
For a year.
And it interrupts her livelihood, which is dance.
Yeah.
So you just dance in pain. You just keep dancing. No,
It
but,
really won't.
but all the dancers that come in here do that. They don't stop unless they have like a torn out knee or something.
Yeah.
So let's do something else now, okay? I'm going to have you lie on your back. You're going to be right here. And I'm going to look at that shoulder a little bit too. So come this way and bring this elbow up. And I'm going to just do a little release in here. Little one, did you hear that?
Yeah.
Good. So now I'm going to have you lie on your side facing me. I'm just going to do a few last things and we'll finish for today, okay? And scoot your body a little closer to me. And keep this leg straight. Let the head come back this way. There you go. One more. There it is. That's a big one.
Yeah.
Good. So come to the other side. I'll meet you over there. This time I'm going to give you a pillow. No. Stay on your side. So you're curled up like this, and I want you to be more upright. There you go. I just have to give you the choreography, right?
Yeah.
And I pull this down towards me like this. That's fine. And then come stand again. And that's it. So we're finished. That's what we're going to do today.
Thank you.
So it's
Part of my body's back.
Yeah, good.